Welcome back. Well, hospitals are admitting high numbers of COVID-19 patients. So let's chat to a nurse who is one of thousands working extremely hard to save lives. Rich Siklina works at the Telle Mokgwerane Hospital in Vosloorus in Ekurhuleni on the East Rand. Thank you very much for joining us, Rich. Now, first of all, we see that the numbers for the third wave seem to be going down in most provinces. But give us a picture of how it's looking in hospitals.
Thank you, Masego, for having us, and good morning to you and your viewers as well. I think it's still early for us to be excited, Masego, but I can safely say there is a glimpse of hope. There is a glimpse of hope, more especially when you are comparing what Gauteng experienced a few weeks ago. Last week in particular, where we have had patients overflowing, we had patients occupying our emergency departments, waiting for beds to be opened or to be available in the wards. We had hospitals being forced to open other COVID-19 designated wards. But at the moment where we are sitting, there's no overflow. But like I'm saying, we do not have to be excited yet, because hospitals are still full. The COVID-19 designated wards are still full as we speak, but there is no overflow. Patients are not lying in casualty waiting for available beds, but COVID-19 designated wards are full. Should we have a skyrocketing rate of infection, maybe, let's say, for whatever reason, in a few days to come, we'll still go back to normal. But at the moment, we do not have overflowing patients.
The Wainetu president had spoken to some media houses, I think, a few weeks ago, describing some provinces and some hospitals in provinces such as Limpopo and, as you say, Gauteng being super spreader places as well themselves, because of patients waiting for beds and basically some of them dying while waiting for beds.
That's what as we have been experiencing since COVID-19 started, more especially because we've always uttered and we've always voiced the issue of dilapidated hospitals and the issue of infrastructure, more especially besides gross shortage of staff and material resources. But the infrastructure has been our biggest problem, and that is why we have seen patients spending more than 7 days in emergency department, and the others had a situation, obviously, where they died in those emergency department without getting a chance at least to go. It's either to a COVID-19 designated ward or ICU, for that matter, to get that particular oxygen. And that is where then the issue of oxygen came to that picture, because obviously when they are all over the place in emergency departments, and we are relying not on oxygen that is in the wards, but on oxygen cylinders. And when we run out of those oxygen cylinders, we will find ourselves hopeless. That is what we were experiencing. And even now, like I'm saying, wards are full, of which if we can let our guards off or be too excited that numbers are going down, we are going to find ourselves back to square one, back to that situation where we had patients dying in emergency department, waiting for a ward to be available, for a bed to be available in the ward.
Tell me something, Rich, with the closure of Charlotte Maxeke still, have you heard anything from any of your members at Wainetu that the closure of that hospital is making things worse, for instance, at Bara or Steve Biko?
It really made, because there was a lot of complaints. There's a lot of complaints that we received as a union. It really put us on a back foot, because obviously, remember, those patients who were supposed to be there, like general patients, not even COVID-19, not even patients with COVID-19 related illnesses, but general patients who were supposed to be admitted there without COVID-19 had to go to different hospitals and occupy beds there. Obviously, they were overwhelming those particular hospitals, more especially Bara and Steve Biko in Pretoria. That is what we were experiencing, and we were getting from members on the ground to say things are just getting out of hand. Obviously, we were already complaining about the infrastructure and insufficient capacity that the province in Gauteng in particular is experiencing. Then the closure of Charlotte Maxeke didn't help us in any way. We experienced a lot of backlog. That's where I personally experienced a family that had their mother dying in casualty in a stretcher. Others spent days in wheelchairs, obviously, because there's nothing nurses can do, there's nothing doctors can do, there's nothing sometimes that hospital management can do, because you can't expand the hospital. If it's full, it's full. Unfortunately, those patients in casualty, they will have to wait for a bed to be available. It's either we admit a patient who is not even yet fit to be discharged. For example, we discharge patients who are not yet fit to be discharged because we had to admit someone who's worse in casualty, and the others had to wait for someone to die. It was just a complete mess and painful situation.
Just very quickly, I'm running out of time, Putrich. Has anything changed in terms of what you've asked for from government ever since March last year when COVID-19 arrived here in South Africa? Are things better? For instance, your PPE, etc., and things that you've asked for with infrastructure and staffing, or is it still the same?
That is why we've always said, as young nurses in the trade union, we have said government has failed all of us. Our government has failed. Those in positions of authority have failed all of us. They threw all of us into that deep end. We complained until we got tired of complaining, Masego. We got tired of complaining because obviously we are a reactionary country. We respond to a mess instead of being proactive and stop it. We went into a situation where we will just go into those particular wards with plastic aprons. Yes, there are hospitals that like my hospitals where I'm working. That's what our government does. They only look after those who are making noise. That is why in my hospitals in particular, we did have a PPE, even though there were days where the PPE we will run out of PPE. But in as far as shortage of staff, shortage of material resources, we are still complaining about that. We are tired and fatigued, unfortunately, because we've been working days on end, and we are still complaining about the same things. It's just that we decided to stand up and say, in the absence of the best, mediocrity unfortunately becomes an option. So in as far as government making sure that public health system is fit and strengthened to face COVID-19 and curb the spread of the virus, no, we have failed, unfortunately.
All right. Thank you very much. That was Nurse Rich Sitlina. He works at the Tele Mokgwerane Hospital and is also leadership in YNU2.